Well, the very next question that pops up in our mind after cancer is diagnosed is how is it treated? So sir, if you can please elaborate on the fact that how is cancer actually treated in today's society?
Yeah, to treat the cancer, we first need to know the type of cancer and the stage of the disease. For most of the cancers, this is the usual practice. So once we are sure about the diagnosis, the type of cancer and the stage of disease, we have to look at what treatment we can offer. The usual treatments are chemotherapy, surgery and radiation therapy. These are the cornerstones of cancer therapy, at least for solid cancers, that means cancers apart from the blood cancers. So for them, these three are the most important. So usually we do a multidisciplinary tumor board where all doctors from each of the streams sit together and decide what treatment is best for the patient. It can be a combination treatment as well, like surgery followed by chemotherapy and radiotherapy, or chemotherapy followed by surgery. It varies according to the type and stage, but these are the common measures. For blood cancers, it's a bit different. The staging is usually not that important. Typing is most important, apart from some blood cancers, and chemotherapy or specific blood cancer directed therapy is the most important treatment in them. Radiation and surgery has got very low or no role in those cancers.
So now that we know that treatment, how it is done, so the next question that comes in our mind is what are the side effects? Like we've heard about many stories, many myths, many confusions, exaggerations, but exactly what are the side effects of cancer?
Side effects depend on the treatment. Like for surgery, the side effects are very specific. Like after surgery, if the surgery is done in one particular part, there can be pain or inability to move that part for some time. If it's an abdominal surgery, then patient may not be able to feed immediately after the surgery, but gradually these things recover. For chemotherapy, I will discuss mostly about chemotherapy because I am a medical oncologist. Some general side effects are there which the patients are afraid of, like vomiting, bowel problems like loose motions and constipation, mouth ulcers, fall in blood counts like hemoglobin and white blood cells, infections and hair fall, which is a dreaded side effect in many patients, especially women. So fortunately we have developed a lot of treatment to counter these side effects. Like for preventing vomiting or preventing the fall in blood counts, we have got many medicines, and most of the time this chemotherapy can be managed at home. For example, patient takes the medicine in the hospital or in the daycare center, but patient can go back, and in between the healing period the patient can stay at home with his or her family. No need to come to the hospital very frequently for that. So one thing I would say that for hair fall we have not yet developed any specific countermeasure, but we have some medicines which we can use in some settings, chemotherapy, which does not cause hair fall. But some medicines are indispensable till date which can cause hair fall, but with time, once we stop that chemotherapy, the patient will regain his or her hair within a short time.
Now that we know the side effects of cancer, we would want to know, sir, what is the treatment? Like the treatment, we've always heard that the people who have overcome cancer, they go through an after effect, a trauma. So is it that the treatment of cancer, is it worse than the cancer itself?
This is also a common perception, but we need to understand that cancer is a deadly disease. If we do not treat cancer, cancer is going to increase day by day, and ultimately it will cause much more symptoms and even death of that patient. But if we can treat cancer, even with the side effects, the patient can be able to overcome that, and ultimately we can control cancer, and the symptoms of cancer can be controlled also. Sometimes the disease can be cured. But if we do not treat, even though the patient is not having the side effects, the cancer will eventually cause more problems.
Thank you so much, sir. Taking a point from what you just said, it can be cured. It is a question, a myth that most of us, it is non-curable, and many such things we hear. So what do you want to tell us? Is cancer curable?
Yeah, mostly people also feel that cancer is a disease which has got no answer, but that is not correct. Many times cancer can be cured. Many blood cancers, many lymphomas, they can be cured. There are many breast cancers which come in early stage, they can be cured. Many cancers which come in early stage can be cured, but certainly not all cancers. Some cancers have already spread to such a stage that it cannot be cured anymore. In those patients, our goal is to control the disease and reduce the symptoms. In those cases, we use the term remission. Sometimes the disease can be completely eradicated for the time being. It may not be for life. The disease may come back later, but for the time being it can be controlled, or the patient can enter a phase of remission where there is no evidence of cancer inside the body. And sometimes the disease may be partially controlled, like partial remission. The disease burden was much more before treatment, and after treatment the disease burden comes down. That patient is not cured, but still we can control the disease.